Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well crafted summary and it highlights only the important keywords. Let's look at sulfonamides. So under sulfonamides, let's look at the mechanism of action. The mechanism of action, it includes the para-amino benzoic acid. So para-amino benzoic acid is nothing but the precursor. It is a precursor of the folic acid, which is very essential. Folic acid is very essential for the growth and also the multiplication. So it is very essential for the growth and multiplication of many bacteria. So para-amino benzoic acid is a precursor for folic acid. It is essential for growth and multiplication of many bacteria. Then come the sulfonamides. The sulfonamides being structurally similar to PLAB, and it competitively inhibits folate. So sulfonamides being structurally similar to that of PLAB, it completely inhibits the folate synthesis enzyme, and it prevents the formation of the folic acid. So prevents formation of folic acid, thereby produces a bacteriostatic effect. So sulfonamides provides a bacteriostatic effect. So what are the drugs under the sulfonamides? The drugs under sulfonamides, it includes a sulfadiazine. Next comes the sulfizazole. Then comes sulfmetazole, sulfadoxine. Then sulfacetamide, silver sulfadazine, then mafenide, also the sulfasalazine. So all these drugs are present. Next, looking at the sulfonamide resistance. So under the sulfonamide resistance, there are presence of microbes. So these microbes, they acquire resistance to the sulfonamides, and by the following mechanism, that is, there can be decreased affinity. So there is decreased affinity of the folate synthetase. Decreased affinity of the folate synthetase. This is for the drug. Next is there is increasing of PLAB. Also there is alternate pathway to synthesize the folic acid. Next, what are the uses of the sulfonamide? The uses of sulfonamide is you can give sulfadoxine along with the pyrimethamine. Sulfadoxine along with pyrimethamine. So this is used in treatment of the pneumocystitis. So pneumocystitis gyrovesi. Also it is used in malaria. Also it is used in toxoplasmosis. Next comes the silver sulfadiazine. Sulfadiazine and the mefenamide. Mefenamide, it is used topically. It is used very topically for the burns patients. Next is the sulfacetamide. So this is used in case of the eye infection, that is in presence of eye drops. Then sulfasalazine. Sulfasalazine is used in treatment of rheumatoid arthritis as well as the ulcerative colitis. Then comes the sulfamethoxazole. So this is along with the trimethoprim. It is used in case of the respiratory infections. It is used in case of diarrhea, also in the UTI, that is the urinary tract infection, as well as a prostatitis. Then comes the drug of choice. It is acts as the drug of choice in case of the isosporiasis. It is used in case of the cyclosporins and cyclosporiasis, the pneumococcus gyrovesi, as well as nocardiosis, and the Burkholderia cepi. Now let's look at the adverse effects. So in terms of adverse effects, there can be allergy. Allergy means there can be rash. There is SJH, Stevens-Johnson syndrome, there can be aplastic anemia, there can be conitis. Conitis is mainly by the bilirubin. So how is the current mechanism is the bilirubin displacement. Because of that there is presence of conitis. Then the cystinuria is present. Then the sulfonamides will also be present. They are basically contraindicated. Sulfonamides are contraindicated in case of the G6PD deficient patient, and it can cause the acute hemolytic anemia.
To learn and grow daily like this, please do subscribe.